Hi and good morning from BBC One, Monday 26th of April, and at 6 o'clock we'll start with breakfast.
Very good morning and welcome to Breakfast with Dan Walker and Louise Minchin.
Headlines for you at 6 o'clock this morning. A country struggling to breathe. India registers a record-breaking number of new coronavirus cases for a fifth day in a row.
Question.
A very good morning from the England-Scotland border, open for non-essential travel for the first time since Christmas. What does it mean for hotels, hospitality and those hoping to get hitched here in Gretna?
Monday, the sport gradually welcomes the fans back.
I'll have all the details in about 10 minutes or so.
Good morning, it's Monday, it's the 26th of April. Top story for you this morning is that India has recorded another global record of new coronavirus cases for a fifth day running, with more than 352,000 infections reported in the last 24 hours.
Hospitals in Delhi have completely run out of beds and some are missing critical supplies, including oxygen. The UK, along with others, is now sending medical aid to the country. Our India correspondent Yogita Limai reports.
The capital is being ravaged at a frightening speed. With every pyre that burns, India's self-belief is dying. Each funeral is a story of personal loss and national shame. Charanjeev Malhotra has been helping to cremate the dead for decades. Now, he barely ever stops working.
I've
never seen such a terrifying situation. I can't believe that we're in the capital of India. People aren't getting oxygen and they're dying like animals, he says. We don't even have enough resources to cremate them properly. Outside, Shivangi Mehra is on the phone organising oxygen for the hospital she works in.
Nothing is being done. I don't know government is sleeping or what they are doing. I am totally disheartened in the situation which I am seeing. Government is a literal failure. A person cannot live here in Delhi. A person cannot even die peacefully in Delhi.
She's waiting to cremate her grandfather, who died, she says, because there wasn't enough oxygen. This small hospital in North Delhi is facing a daily struggle.
Ma'am, we have been spending sleepless nights since last 1 week. I mean, at times we feel like crying because we are not able to help patient properly. Every day it's the same scenario. We are left only with 2 hours of oxygen, 3 hours of death, and we are only getting assurance from the system, no oxygen.
And so, families are being told to organise oxygen. At one medical shop, we found people with empty cylinders waiting to buy their own supply for loved ones who urgently need it. For many here, the government's promises of rushing in oxygen are coming too late. Families left asking why something so basic is unavailable.
Every crematorium we've been to, we've seen body after body being brought in. It's hard for anyone to keep count, but what workers have been telling me is that the real scale of deaths caused by COVID-19 in India is a lot higher than what official numbers reflect. And a lot of those who've died right now have done so because they couldn't get oxygen in time.
Jitendra Singh Shanti runs a group of volunteers here. Even young people are dying. It's a very bad situation. If it keeps getting worse, we'll have to burn bodies by the side of the road, he says. There is a sense of abandonment in this country. Citizens are stepping up to do what a government should, left to fight a vicious pandemic on their own. Yogita Limai, BBC News, Delhi.
The UK's most senior civil servant. And we were talking about it throughout the programme this morning. Restrictions easing in Wales and in Scotland today. There are changes there. There was an open letter, wasn't there, from scientists yesterday calling for face masks and social distancing to end in June. What are your thoughts?
Well, OK, so I don't mind colleagues having different opinions. This is an open letter that was sent out by eminent scientists saying that there should be no masks, no physical distancing, and no further lockdown. Science is always going to be debatable. There will be some people who will be producing one article and then another article that will counteract that one. That's the point of science. But at the minute, I think that if we look around us, we're in a global pandemic. You just have to look at the situation in India. That's a humanitarian crisis. The peak at the minute hasn't even hit in India. And the prediction is that there are going to be 13,000 deaths a day. That's 90,000 deaths a week. I mean, it's horrific. And if we look at our European friends and counterparts, they're in their third wave and they're in another lockdown and they're struggling. Brazil, South Africa. I mean, you just have to look across the world. So we know that the measures that work, vaccines is one, but actually it's the other measures that really work, such as lockdown. If we look back in hindsight, when I was talking to you guys back in before the third and the second lockdown, we weren't too far off that situation that we're seeing in India. We were going to the point that we were overwhelmed in our hospitals. We were overwhelmed with the amount of oxygen that was needed. And there were issues in and around various hospitals where there was a lack of oxygen as well. So although we can look at India and think this is, a horrific situation, but in the UK, we weren't too far off that. And so those measures of washing your hands, physical distancing, making sure that we are abiding by the rules, hand washing, all of those things are going to play a role. So I disagree that this open letter should be, I disagree with my colleagues on this one because it's reckless, actually, to be able to say to people that we will come out of this pandemic on the 21st of June and everything will be completely fine, because we still need to be careful because we don't know about variants yet. We don't know if the vaccine is going to be as effective against variants, and we cannot have a fourth lockdown. I don't think we will survive it.
Well, listen, thank you very much. Good to chat to you as ever, and thank you for your opinions on that, Dr. Nigat Arif, as ever. Now, basically Monday GP, I've decided.
She's got Monday covered, hasn't she?
She has, so that's for ages.
Sally is with us.
Now from our correspondent Nikhil Inamda, who joins us from Miraj. And, these numbers, they are truly devastating, aren't they, for India? What more can you tell us?
Well, absolutely. I mean, if you just look at the last 24 hours, 352,000 fresh new infections, over 2,800 people losing their lives. And according to one report I saw, new infections being registered at the rate of 243 every minute. India's tally now over 17 million. And this is the fifth straight day of record spikes that we're seeing. In terms of the oxygen situation, as Yogita's report delineated, it's not very good. The demand far continues to outstrip supply, despite several measures being announced by the government, including running special trains and getting in the Air Force to chip in. SOS calls continue on social media, with hospitals asking, for more supplies of oxygen, saying they barely have a couple of hours left. The Prime Minister has announced in the last 24 hours that he would be setting up new oxygen plants in every district in the country, but that's not going to help alleviate the immediate situation, the immediate crisis of oxygen that we're facing. The good news really amid all of this is that the international community is now really stepped in great numbers to try and help India.
Thank you very much for bringing us up to date. Thank you.
Now, pressure is growing on the Prime.
She's waiting to cremate her grandfather, who died, she says, because there wasn't enough oxygen. This small hospital in North Delhi is facing a daily struggle.
Ma'am, we have been spending sleepless nights since last 1 week. I mean, at times we feel like crying because we are not able to help patient properly. Every day it's the same scenario. We are left only with 2 hours of oxygen, 3 hours of death, and we are only getting assurance from the system, no oxygen.
And so, families are being told to organise oxygen. At one medical shop, we found people with empty cylinders waiting to buy their own supply for loved ones who urgently need it. For many here, the government's promises of rushing in oxygen are coming too late. Families left asking why something so basic is unavailable.
Every crematorium we've been to, we've seen body after body being brought in. It's hard for anyone to keep count, but we've seen body after body being brought in. It's hard for anyone to keep count, but what workers have been telling me is that the real scale of deaths caused by COVID-19 in India is a lot higher than what official numbers reflect. And a lot of those who've died right now have done so because they couldn't get oxygen in time.
Jitendra Singh Shanti runs a group of volunteers here. People are dying. It's a very bad situation. If it keeps getting worse, we'll have to burn bodies by the side of the road, he says. There is a... Citizens are stepping up to do what a government should. Left to fight a vicious pandemic on their own. Yogita Lamai, BBC News, Delhi.
In England, so we're going to get across the border soon, so that's the main restriction for us. We haven't seen our family over the border for over a year.
Thank you very much. Yes, that's one of the other things, opening up all travel restrictions across Scotland, and also you can travel from Scotland to other parts of the UK from today. So lots of changes that will be feeling much more normal.
Big day. Thank you very much for that. See you later on. It's there about what they're looking forward to. Just normal stuff is what we're looking forward to, yeah.
28 minutes past 7. Breakfast with Dan and Louise.
It's just gone 7:30. It's Monday morning, and the UK has joined the global aid effort to help the growing coronavirus crisis in India as a devastating new surge of infections grips the country.
More than 600 pieces of medical equipment, including ventilators and oxygen concentrators, will be dispatched this week, with the first shipment due to arrive tomorrow. Let's talk about that. Lots of other things as well with the Defence Secretary Ben Wallace, who joins us from Portsmouth. A morning to you. Thank you very much for joining us. Lots of things to talk to you about. Hello. First of all, how concerned are you about the scenes that we're seeing from India?
Well, I think we should all be concerned, and I think it's one of the fears that all governments have, which is, you know, managing an outbreak like this. What happens when it hits the health system, and what happens if the health system starts to become overwhelmed? And that's why, you know, Britain, alongside I think the United States and other countries, have been pretty quick and determined to offer our help to India, and that's what we're going to do, as you've just listed earlier. We're going to get out there, help them with those challenges around ventilators and oxygen, which is where their trouble is at the moment, and that's really, really important that we all come together and help our friends and allies that way.
And how concerned are you by the kind of wider spread of that Indian variant?
Well, I think at the moment we're obviously collecting the data on that, and I think what I would say is we're watching with concern, but we're not yet in a place where we have made a view of exactly how damaging or not as it might be to our own outbreak here. I think the key here is it reminds all of us watching this why it's important to have a slow and steady roadmap out of the pandemic, and why we should take each step as they come, not rush forward or come back, and that's what we're doing now. That's why I think all of us today in the United Kingdom recognise that there's some really good news out there, which is 62% of all adults are now vaccinated in the United Kingdom, over half the adult population, and people up to 44 years of age will now be offered the vaccine. That's good news, but that doesn't mean to say we chuck it all in and rush headlong for the door. And I think that's why we've got to remember that at the heart of a lot of managing these pandemics is managing the flow into our hospital system so the hospitals can cope. And that's why it's, you know, going forward steadily, getting the injections done, but the same thing, just remembering what's going on in the rest of the world. And you don't have to go very far, even very far, you know, into Europe to see what happens when things get out of kilter. And that's why we'll help India, but we'll also continue to roll out as a government and alongside all the amazing volunteers, the vaccine programme.
Just on the vaccines, because we know that India is a major producer of vaccines for everybody all around the globe. Do you think the UK should perhaps forego the vaccines it's been promised that are made in India?
Well, I think what's happening overall is you know, one of the strengths of the United Kingdom's response and the government's response to the vaccine was they chose a diverse supply chain. We're not just getting it from one type of vaccine. We haven't sort of just narrowed ourselves to AstraZeneca. We've got AstraZeneca, Pfizer, and a whole more others made all over the world and made in the United Kingdom as well. And I think that gives us options. And I think, you know, we will stand by to do what we can for our friends around the world at the same time as continue to roll out for the United Kingdom. But you know, the supply...
Sorry to interrupt you. Might that include foregoing those promised vaccines?
Well, I think at the moment, India is already, the Indian government has put a bar on a number of exports of vaccines, and I can't tell you whether that definitely includes the United Kingdom exports, but it does include a number of exports around the world. And I think India are trying to deal with their problem as they are. They can manufacture it, so they have the means to do that. That's good. That means they're more fortunate than many other countries. But what we've got to make sure is that it's not just about the vaccines. It's really the here and now, and all these awful reports we're seeing on the media from India is about the hospital system. And that's why we've got to get in there, help them, offer what we can in ventilators and oxygen to make sure that the hospitals don't fall over.
Now, over the weekend, you will be well aware.
What we don't have is we have allies, we have friends, whether that's Japan, whether that's India, whether that's the United States and Europe. We stand for the same values, and it's really important at this particular moment in time that we stand in solidarity and come together around the world to stand up for those rights when they're under threat.
Defence Secretary Ben Wallace, thank you for your time this morning. Thank you.
Thank you, Louise. Thank you.
At 7:45, Sally is also with us this morning.
A lot of speculation around this. The simple fact is the Prime Minister has paid from his own money.
Struggling to breathe, India registers a record-breaking number of new coronavirus cases for a 5th day in a row.
On the England-Scotland border as non-essential travel reopens, but there are different rules over there to over there. What does that mean for hotels, hospitality and those heading to Gretna?
Sort of allegations that it's just going beyond the reality. And, the Prime Minister is I have known him personally for many years, and the idea that he is going to go around saying things like that is just wrong.
India has recorded another global record of new coronavirus cases for the 5th day running, with more than 352,000 infections reported in the last 24 hours.
Hospitals in Delhi have completely run out of beds, and some are missing critical supplies, including oxygen. The UK, along with others, is now sending medical aid to the country. Our India correspondent, Yogitha Limai, reports.
The capital is being ravaged at a frightening speed, left to fight a vicious pandemic on their own. Yogitha Limai, BBC News, Delhi.
Around 500,000 44-year-olds in England will be invited to book their first dose of a coronavirus vaccine from today.
Look inside that room there where people got married there since the early 19th century. A real reminder of what is across the UK while travel is restricted abroad at the minute.
Thank you, Nina. I think you said lots of couples. I'm not sure. Did you say somebody specific got married there, Nina? I'm not sure, but she probably can't hear me now either, can she? Can you?
No, she's gone.
No, she's gone.
All disappearing into the televisual ether.
I don't know.
Well, I think that it says over 10,000 marriages before
I think that's
since
what it was.
1830. I think that's probably what she was getting at. Then we got to the bottom of that in the end.
Also.
Yes, hospitality venues in Wales can start serving people outside from this morning. Let's speak to our Wales correspondent, Thomas Morgan.
And obviously just, enjoy yourself safely. There's a big tagline, keep Wales safe at the moment. Wash your hands, wear your mask at all times or where possible. And just, like I said, just enjoy it safely.
Brilliant. Thank you so much, Jay. A little bit nippy for a G&T at the moment, but hopefully when the sun comes out in the shadow of the Millennium Stadium, the punters here today will be sipping one nicely in this warm Welsh weather.
Thank you, Thomas. We'll speak to you a bit later on this morning. Have a good day.
Yeah, I think you will. 22 minutes past 8. Now,
thank you very much for talking to us live on Breakfast.
He makes some very good points, doesn't he?
He does make some very good points. And I'm just listening to him there. I remember exactly what you were saying last year when you took that step away from it for a while, and you really benefited from it, didn't you?
Yeah, still benefiting.
Yeah.
All right, now let's get the news of travel and the weather wherever you're watching.